Today we are at the Emergency Operations Center, or the EOC, where we coordinate and execute the polio program in Mozambique. Right now we're in the middle of a vaccination campaign where we are vaccinating around 6.9 million children in all of Mozambique. So today we are coordinating, we're following up how we did yesterday, and we're trying to improve our plans day by day. Today, we are continuing to vaccinate children all over the country. We're following up with over 16,000 teams that we have on the field vaccinating children. We're making sure that no child is left behind. We are constantly monitoring and talking to our teams on the field to make sure that they're doing what they're supposed to be doing, but also if they have any problems or their children that they can't reach, we come up with new strategies if needed. So we're basically coordinating the whole campaign from this little office. Campaign is happening because we had a case of wild polio virus in the province of Tet, and every case of wild polio virus is considered to be an outbreak, and therefore it's also a national health emergency. So we are responding to that by vaccinating all the kids. Polio is one of those diseases that is on WHO's list of a disease that is a threat to mankind. But it's also a disease that can kill or paralyze a child, and there is no cure for polio, but there is an easy prevention, which is vaccine. So we're making sure that the children out there can at least run and play and don't have to worry about polio. So the teams, we have the vaccinator who gives the 2 drops of vaccine. So with polio, when we respond to an outbreak case, we don't give injectional vaccine, we just give 2 drops because they're easy to administer, and we can give them at the parents' houses. So we go from door to door. It's kind of a luxury service. And with the vaccinator, we have a social mobilizer. She will talk to the parents, she will talk to the priests, the community leaders, and engage them in the campaign, so they also can help us inform the parents. And then we have somebody who registers the uptake of vaccine to make sure that there is enough vaccines to reach the children. So basically, when it comes to polio, the more data you have, the better it is. So partly we check our vaccine use and the vaccinators reports, but also when we monitor the teams, we can tell we have a unique system known as the ODK, where we sort of track the teams by mobile phone. So we know where they have been, what the temperature of the vaccines are like, but we also know if the parents have been reached by social mobilization. And this helps us make an even better strategy for the next day. One of the really good things about working with polio in Mozambique is that we have all the partners together. You know, we have WHO and UNICEF and CDC, and of course the Ministry of Health who is leading the whole campaign. And we're sitting in the same room and we're discussing the best strategies. And not only do we do a really important work together, but it's actually a very good camaraderie as well, which makes us a really strong team. And of course, the best thing about work is actually going out to the field and monitoring the teams that they do their jobs. But I also like the togetherness that we are one team.